Excellent. Thank you so much, Lim. It's really good to see the progress that's been made by PVN. I think it's a really good network that serves to highlight the importance of vector surveillance and control for the region. And just a quick historical reflection, it was, I think, some of the impetus for establishing the PVN came from the establishment of the Global Vector Control Response. And it was actually Fiji that was a country that requested the development of the Global Vector Control Response in the WHO Executive Board in 2016. So Fiji specifically requested WHO to develop that, who then took a year to develop it before it went to the World Health Assembly and was endorsed. And then we had PVN being established later as well. So just a historic reflection then on how important this kind of network is to really elevate vector surveillance and control in the region. Thanks, Lim. And now on to Anna, a good friend of mine who I first met in 2014 working in Geneva. So Anna is now based with CDC and will be providing an update on CDC's support to vector surveillance and control in the Pacific and beyond, I think, Anna. Thanks, Anna. Over to you.
Thanks very much, Tessa and PacMOSSI organizers. It's great to be here and be able to join this meeting, and also to be able to add on to some of the great work that's been talked about so far from partners who I've worked with previously in this area. So today I'm going to be sharing a little bit about CDC's current work and collaborations to really enhance vector surveillance and control, and focusing on some of our strategy and partnerships and capacity building efforts. So next slide, please. So I did want to start with just a very little bit of context, and I'll go through this pretty quickly. So just to say that one of the reasons that that the CDC is very interested in working globally, internationally, with partners has to do with some of the background of vector-borne diseases trends in the U.S., which really have expanded and increased over recent years. So between 2003 and 2023, we've had over 1 million cases of vector-borne diseases, and we're seeing these numbers really increasing over time. And we're finding these cases, the reported cases, really only scratch the surface. So where our current estimates are, even with Lyme disease, we're having almost 500,000 diagnosed and treated cases each year. We're also seeing more frequent outbreaks of imported diseases like dengue and chikungunya, which really highlights the need for early detection and rapid response. And I pulled a couple of headlines, recent headlines on this slide, which illustrate really how these diseases are making news and straining public health systems and appearing in places we didn't expect. And they remind us that vector-borne diseases are not just data points. They are real and growing threats that demand proactive surveillance and control. Next slide, please. So a bit of context on where we sit. The Division of Vector-Borne Diseases is a specialized branch in CDC. It's headquartered in Fort Collins, Colorado. Our mission is to protect the public from illness and death from vector-borne diseases. And the Division of Vector-Borne Diseases operates under the CDC's National Center for Emerging Zoonotic and Infectious Diseases. Our work encompasses a fairly broad spectrum of activities. So this includes surveillance and diagnostic and research, and as well as the development of prevention and control strategies. Our priority diseases are on the slide. We really focus on diseases like Lyme disease, West Nile virus, dengue, Zika, and chikungunya. And we hope that with our efforts on these diseases, both within the U.S. and working with partners, that will help to reduce the burden of vector-borne diseases and really enhance public health responses, both domestically and internationally. So the question is, how do we put this in practice, especially in regions like the Pacific? So next slide, please. And so one of the ways that we put this in practice is through supporting public health vector control interventions. And so these are targeted projects that work to scale up and test and to scale up innovative vector control tools in real world settings. We're hopeful that some of these efforts will help us understand what works, under what conditions, and how some of these strategies can really be adapted locally. So I'm going to just touch on two projects that we have supported in the past. The first is with the Republic of Marshall Islands. So we've partnered with the Ministry of Health and Human Services and RMI, with PIHOA and the technology provider on genetically modified Aedes aegypti intervention in Ebi on Kwajalein Atoll. So this project really focuses on entomological impact and operational feasibility and community engagement. So at this point, baseline data collection for this project has been ongoing for several years and is now largely complete, and the project is now entering its second phase of GM mosquito release. We're already gaining a lot of valuable insights from this, things like insights into mosquito population dynamics and into the logistics of implementation, particularly in high density island settings. So another partnership that we have is evaluation of the SIT implementation in French Polynesia and Cook Islands. So this was a project that we supported with partners to evaluate sterile insect techniques. So this project is led by Institut Louis Maillardet in French Polynesia. It's designed to assess both entomological and epidemiological impact of SIT in small island settings. And there are also a lot of valuable insights from this, exploring factors like community acceptance, release logistics, costing implications, as well as some really interesting work on biomarkers of human vector contact. So the aim here for our part, for CDC's part, is to generate actionable guidance for countries considering SIT as part of an IVM strategy. So from both efforts, we've learned pretty valuable lessons, like production and sterility targets, lessons about local rearing infrastructure, and a lot of lessons about designing studies that are both feasible and rigorous. And we really feel like these projects are platforms for applied learning. They really help build practical know-how and the need for scale up, and represent really strong opportunities for collaboration. And we hope for regional impact. Next slide. Okay, so just to touch on some of our projects and collaborations, the second way that we really work to forward the CDC's mission and put this in practice with some of our Pacific partners is through partnerships and capacity building. So we work both domestically and internationally to strengthen systems for surveillance, diagnostics, prevention, and response. So domestically, we support U.S. territories and freely associated states through grants called Epidemiology and Laboratory Capacity Program. So this works directly with health programs to help improve vector-borne disease prevention and response. We also have 5 CDC centers of excellence and 4 training and evaluation centers that are spread across continental U.S. And these are in place to help CDC conduct both applied research as well as evaluate tools and technologies, train current and future workforce, and build communities of practice. So we're very focused on how we can best use the resources and networks that we have in the US to help support a lot of our vector-borne disease prevention and control efforts. The Pacific Southwest Center of Excellence, PAC-VEC, is one of our COEs, our Centers of Excellence, that works as a key partner in building entomology and training capacity in the Pacific region. Globally, we also work to strengthen preparedness and response capacity, and I've just taken this as a quote from our website. This is still a priority in our interconnected world. A disease threat anywhere is a disease threat everywhere. So that is one of the reasons that we continue to support efforts on a whole host of vector-borne diseases internationally. So we support efforts on plague and yellow fever and arboviruses and vector-borne disease threats through partnerships in particular that help enhance technical capacity and coordination and regional leadership. And so one of the most effective ways that we support this is through entomology networks. So the next slide highlights how the VecNet project and its supporting networks are building regional capacity, especially, and I'll touch on our work in the Pacific, although Lim has explained most of what Pacific Vector Network does, but this is the overall CDC's VecNet project. This project is a cross CDC project. It was really the brainchild of one of our other divisions in CDC, the Division of Malaria and Parasitic Diseases, and we work together to support entomology networks globally. We really have the goals of strengthening and expanding regional surveillance, of enhancing vector control capacity, formalizing information sharing platforms, and also really to help build the long-term sustainability of networks. So we feel that VecNet is really a model to help build trust and technical support through regional partnerships, and we've really leveraged a lot of the great networks that are out there to try to bring everybody together towards these same ends. So next slide, please. So just a little bit more on VecNet. VecNet supports 7 entomology networks around the world, and each of these are tailored to regional needs. Could you click through once? Thanks. So, so in the Pacific, there are 2 networks that cover that cover the Pacific. So PVN really is Pacific focused. But the countries that have struggle with malaria and are working towards malaria elimination are also covered under APMN. And so the PVN covers 21 countries and territories, and these networks facilitate joint training and coordinated responses, and really work towards helping support vector surveillance and control and public health entomology. So I'm not going to talk too much about PVN because Lim, I think, has covered this very thoroughly, but I'll just give a little, if you go to the next slide.
Just
please.
1 minute left too, Anna. We're a bit short of time.
Okay, just a couple more. So I just wanted to give one recent example of some of the work under VecNet that's supported by APMN. So this is work done by Division of Malaria and Parasitic Diseases in CDC. It's a network that this work was sponsored by CDC, but hosted by Papua New Guinea Institute of Medical Research and organized by APMN. And this was a training, vector surveillance and training course held in Papua New Guinea. Next slide, please. And these were the topics that were covered and some pictures from the workshop. Next slide, please. So just to say that that all of this aligns within broader U.S. national strategy for prevention and control of vector-borne diseases. And I'm not really going to go into this, but these same priorities really underpin our Pacific work. And then next slide. Okay, so just to close, we have a lot of really strong progress, and we're hoping to be able to continue our commitments to this work. Investing in people and partnerships and innovation for a shared vision. So a future where vector-borne diseases no longer threaten human health and well-being. So I think that should be my last slide, or maybe one more. Yep. So thanks. My contact information is here on the slide. Please don't hesitate to reach out if you like to learn more about any projects or explore collaborations. Thanks.